Good morning, I'm Dr Kerry Chant from New South Wales Health with the COVID update for Tuesday the 14th of December. There were 804 cases of COVID reported in New South Wales to the 24 hours to 8 p.m. last night, and there were 86,000 tests. Thank you very much to every one of you for coming out and getting tested. We've got a total of 85 confirmed cases of the Omicron variant. However, we are expecting those case numbers to increase over coming days as the genomic sequencing is performed to confirm that they're Omicron. And we are of the belief that Omicron transmission is accounting for our increased case numbers at present. Sadly, New South Wales Health is today reporting the death of a woman in her 60s from Albury area in New South Wales who died at Goulburn Valley Hospital in Victoria, and she was not vaccinated. But can I express my condolences to her family at this most difficult time. We currently have 168 COVID cases admitted to hospital, with 21 in intensive care, 9 of whom require ventilation. And pleasingly, across New South Wales, we're so close to that 95% people aged 16 and over to have received a first dose. We're at 94.8% and 93.1% are fully vaccinated. We've got that 12 to 15-year-old age group is staying stubborn at around that 81.4% for first dose and 77.7% are fully vaccinated. Can I just urge all young people to come out and get vaccinated? We're entering a very social time. It's really important that you are protected, but also providing protection to those that you come in contact with. New South Wales Health is urging everyone to get their booster doses as soon as they become eligible. You may be aware that ATAGI's reduced the interval to 5 months for those boosters, so please get a booster. We know that the Omicron variant, you achieve the best level of protection by having the booster dose in relation to the Omicron variant, so please come forward and get vaccinated. As we approach the final stage of the New South Wales Government roadmap for easing COVID restrictions tomorrow, we're urging everyone across the community to continue to practice those COVID-safe practices. So whilst it's not some of the restrictions on mask wearing are easing and some of the other general restrictions, it really is important that you can still take those protective actions. You can still continue to wear a mask in those indoor crowded settings. Most importantly, don't go out and about when you've got symptoms. Instead, stay home and get tested. Also, for those that are going to large functions or venues, you can also use rapid antigen tests before you go for that added level of assurance. But please don't use them if you are a close contact of a case, or don't use them if you have got symptoms. They are a useful adjunct, but in those other circumstances, we really do want you to have that nose and throat test, which is readily available and will be even throughout the Christmas New Year period. As you can see from our 804 cases reported today, we have been seeing a rapid surge in the number of cases in New South Wales, with transmission occurring as a result of high numbers of people gathering for social functions in venues such as pubs and clubs. And some of these gatherings have led to super spreading events. And because of that, we anticipate that case numbers will continue to rise. So we're particularly concerned about Newcastle area because we've seen a number of venues linked to the Omicron variant, which we know is more highly transmissible. And in those settings, we've seen, for instance, cases at the Argyle House nightclub. And of the about 650 people who attended the Argyle House nightclub, we've found to date about 150 people have tested positive to COVID, and we will expect more cases. And New South Wales last night alerted the public to new venues in Newcastle, the Finnegan's Hotel at 21 Derby Street, and also remains, as I've said, concerned about those other venues we've highlighted over recent days. We are aware that at least 6 people were present at the Finnegan's Hotel that were infectious, And so again, that's why we've called out that particular venue. We are expecting there to be additional cases. So anyone who attended the Finnegans Hotel from 6:30 p.m. on Friday the 10th of December to 2:30 a.m. on Saturday the 11th of December is a close contact and must immediately get tested and isolate for 7 days. And all household contacts of close contacts must also be tested and self-isolate until a negative result is received by the household. Again, the Argyle House nightclub, we've been clear about our public health advice in relation to that venue. The reason we are contact tracing these venues is because we believe that they've been super spreading, or the potential for super spreading to have occurred. And what we're trying to focus our contact tracing efforts at this time is to protect communities from high-risk super spreading events by moving quickly to identify the close contacts. And we're particularly concerned about trying to make sure that people who might be working in aged care, disability, in our hospitals, in those very sensitive settings, that they actually don't go to work unknowingly infectious. So that's the aim of our contact tracing, is to reduce the impact, particularly on those settings where we have very vulnerable people that, whilst they might be vaccinated, the vaccines may not afford them the fullest protection. So please follow the public health advice. Please continue to get tested. Please wear those masks indoors when you're going, particularly into crowded indoor settings. There are these simple measures you can take to help us just suppress the level of virus transmission in the community. And I thank you for all your ongoing efforts, and those test numbers are really pleasing to see. But my key last final message is continue to come out for vaccinations. We've still got some more work to be done. I've indicated those 12 to 15-year-olds. I've also indicated that, we've still got people that are due for their second dose. We've got 5% of the population not vaccinated, and we need to get those boosters into everyone. So a big thank you to our pharmacists, GPs, and our own state-run clinics for their massive efforts at this time of year to assist the population in responding to those calls for vaccination. So thank you.